Hello, everyone. My name is Don Self. I'm with Don Self and Associates in East Texas. This is going to be a quick mini webinar about the new medical decision making that is for the 2021 office visit codes only. Remember, this year we have a different set of rules. Here is my disclaimer to make sure that the attorneys don't go wee all over themselves. I'm not an attorney. I'm not a doctor. I've been doing this for 35 years. Maybe this right here will help you. I hope it does. Now we know that in 2021, we get to count either MDM or time, either one, whichever one gives you the higher level. If time gives you the highest level, you get to bill it. If medical decision making gives you the higher level, we get to bill it. And time will not drag you down. Now, in 2021, on the MDM medical decision making, we have different things we're looking for. This year, we're looking at number and a complexity of problems. We're looking at the amount and or complexity of data, as well as the risk of complications. Just like we had last year, it's still 2 out of 3. Whichever two of the highest ones gives us the level of medical decision making. Or we can build based off of time, but that's a different webinar. Now, one of the differences this year for the 2021 outpatient, again, outpatient meaning office visit codes, 99202 to 99215, is you'll notice a similarity from 99202 is straightforward level. It's a minimal problems, minimal data analysis, and minimal risk. Same thing with 99212, straightforward, minimal. And then 99203 and 99213, both is low level of problems, limited area in data analysis, and the low level of risk. So that's something that's going to make it a lot easier for us. I know there's some out there telling you that this is all complicated. Trust me, it's not complicated. Now, when we're talking about complexity of problems and number of problems, what is a problem? Well, we're going to go over that. But basically, we have straightforward, low, moderate, and high. A straightforward would be a problem that's going to run a defined area. It's going to mostly take care of itself. It's a code. It's something like that, that's going to come and they pass on. No matter what happens, it's going to follow the same course of action. Low would be like controlled diabetic or controlled hypertension or controlled chronic condition that you have. Moderate would be controlled diabetic and hypertensive. We're talking two chronic conditions right there. An uncontrolled, one condition like uncontrolled diabetic or uncontrolled hypertensive. And high would be patient having acute problems right there when we're talking about the complexity, meaning like acute myocardial infarction, pulmonary embolus, severe respiratory problems, COVID would fall into this category, et cetera. Those would be high complexity problems. Now, again, when we're talking about a problem, that's a disease, a condition, or the symptoms, or the illness, or injury, or whatever the finding or complaint is. They've really left this thing wide open for us this year. Really, they're making this a lot easier, much easier for us. Now, when we're talking minor or major, a minor surgery is something that happened to someone else, and a major surgery is when it happened to me. Okay, enough jokes. Let's get back to this because we're making this quick. When we're talking about a straightforward or minor problem out there, it's going to be self-limited, like a sprain, upper respiratory infection, measles. It's going to follow the same course of action no matter what we do. Yes, we might be able to simplify some of the symptoms or alleviate some of the symptoms with some cough medicine or something else, but there's no exhaustive list on this right here. It's just a minor problem right there. Now, if we're talking about low, that would be like a chronic stable illness. And that's one the ones that you're going to have probably the rest of your life. For instance, I'm hypertensive. And if my hypertension is controlled, then great. Now, if I start running 150 over 110 all the time, it would be not be in the low area. That would be in the moderate area right there. Moderate chronic condition would be something that's worsening or it's poorly controlled or I'm just not doing a good job of taking care of it. Or it could be an uncertain or undiagnosed prognosis on this right here. We're not exactly sure what's going to happen with this particular patient. Now, that would be moderate for chronic. Now, moderate with acute would be slightly different. That would mean that we're requiring some kind of medical intervention that we're having to check other body systems, et cetera, with. Has a high risk for morbidity without medical intervention. In other words, if we don't take care of it, this is probably going to get much worse for the patient. Now, we can take care of it and maybe it won't get so much worse. Now, if we're talking high, Those are the serious ones right there. Severe progression, severe side effects. There's a significant risk of morbidity, and we have to make a decision on whether we're going to hospitalize them or not. And it could possibly pose a threat to life or bodily function or short-term conditions if we don't treat it right there. Now, when we're talking about data, we're also talking about tests, and we're talking laboratory tests, diagnostic imaging, physiologic data, etc. The differentiation between single and multiple unit test is pretty well what the CPT has had for years. Like a clinical lab test, a basic BMP, that would be a single test. Chest x-ray, two views, that's considered to be a single test. Now, if you do an EKG and a chest x-ray, that would be two separate tests right there. When we're talking about the level of risk, the level of risk is real simple right here. 99202, 99212, that's considered to be straightforward. Minimal list, it's a minor problem. Self-limited, I mean. Minimal level of data that we're looking at right there. We're looking in the nose, looking at the mouth, okay? We're not having to order all kinds of lab tests. Yeah, you have a code. It's pretty common, okay? And there's almost zero risk. There's minimal risk for treating that code right there. Now, let's say you have self-limited problems such as a stable chronic illness. That would fall into the low area, 99203, 99213. That would be like if you have diabetes that's controlled, like my wife's A1C, let's say it's running under 7. Or my hypertension is running, I'm doing 135 over 75 all the time. That's controlled. That's chronic, but it's controlled. I'm going to have it the rest of my life. And as far as what the doctor's looking at, they're looking at any combination of two of the data. That would be a limited level of data, such as a review of prior external tests right there, or reviewing results of each test. We're looking at his EKG, and then we're ordering a BMP or something on that patient right there. And if we're not billing out for the EKG and we're not billing out for the BMP, we get to count it. Now, if we're having somebody else do it, then we can look at it and count it. But if we're billing it out ourselves, we really have trouble counting it in this area because that would be double dipping or double counting. And everybody knows that that's frowned upon in this business. A moderate area would be like if you have two or more chronic conditions, like my wife has diabetes and hypertension, and let's say that they're both controlled right now. That would put us into the number and complexity and the problems of stable. But the doctor may be looking at prescription drugs on that my wife is taking. Okay, we need to adjust your metoprolol. No, I'm on that. She's on lisinopril. We need to adjust your lisinopril. We need to adjust your metformin. That would be prescription drug management. So, and that risk of complications, that would throw us into the moderate area. But if you go over here in the elements in the middle column right here, where it says amount of complexity of data being reviewed and or analyzed, it might be that you only have a very low area right here with my wife, because then maybe they're reviewing some lab test that was done by someone else, or an EKG that was done at the hospital, or the previous EKG was done. We're not ordering a new one that we get the bill off of. Then we get to count maybe just one or two areas, 1 or 2 points in that area. And then the high would be chronic illnesses. It's got some severe problems. And we're looking at any combination of 3 from the center column right here on data. Review of prior external notes, review of the results of each unique test, and we're ordering additional tests right here. Well, we're having to talk to an independent historian, a family member that we're asking questions of, or another provider. Discussion of the management of the test interpretations. That's where we're talking about the test results with the radiologist or the cardiologist or something else. Then you go over to the high area, and that means where the doctor or the nurse practitioner or PA is trying to make a decision upon hospitalization. That doesn't mean they have to decide to hospitalize, because it's a decision regarding hospitalization, not resulting in hospitalization. And maybe they're not sure if they want to hospitalize them or not, and that could be falling into that category. So let's go over here and let's take an example. Let's say we have a patient right here that comes in with 2 or more chronic stable illnesses like my wife has, or like I have. But we have a limited area right here of data being reviewed. It wasn't really high, just a very limited area. Maybe we reviewed one area up here of the test test results. And then let's say that the doctor or nurse practitioner or PA is doing some kind of prescription drug management. That would fall into this category. So that means that we'd have a moderate level of medical decision making. Could that be done in a matter of where maybe it was only 10 minutes visit? Yeah, that would be real easy. Maybe even a 7-minute visit, depending on how good the doctor is or nurse practitioner or PA is. But that moderate level of medical decision making is going to have it at a 99204, a 99214 level, depending upon its newly established. Let's try another one over here. Let's say we have a patient right here with a couple of chronic diseases, but they're both uncontrolled. Hypertension's high, diabetes is high. And at the same time, we look over here and we find that the number of tests that we're being analyzing or the data that we're analyzing is in the moderate area. But then we go back over here and the doctor's not sure about hospitalization, or we're having to talk to the patient about end of life decisions, et cetera. Then that would give us a 99205 or 215. It's pretty simple. Now, this morning I created a 1-page sheet right here for doctors to use, or nurse practitioners or PAs to be able to use, simply for a progress note for office visits in 2021. Now, this one's not designed to be used for hospital, nursing home, home visits, assisted living, etc., because those are still using the 95, 97 rules this year in 2021. This is January 12th, 2021. So these rules are for that I just went over in the last 14 minutes is for E&M visit codes 99202 through 99215 only. If you're doing doing hospital, nursing home, etc., you'll still use the 95, 97 guidelines. And by the way, if you want that webinar, you want that spreadsheet, it's on my webpage at donself.com/EM. And you can download it in PDF or Word and change it and use it all you want to. It's free. If you ever want me to, I'll spend a half an hour, I'll spend an hour with your provider, your doctor, your manager, your billing person, answer questions, ask questions, and I'm probably going to make, if you're in primary care, I'm probably going to make you an extra 100, 150,000 a year. I do that several times a week, and almost always results in an additional 100,000 a year. Thank you. Come back and visit my website. I'm here to try to help you anytime we can, and we want you to know we appreciate you.